On this episode of the Green Street Beat, we talk about the Substance Use Disorder Treatment Program, Safe Passage, and how the Lee Summit Police Department has partnered with behavioral health providers to aid those seeking help. We will discuss the Safe Passage process, what the program offers, and more. Let's get to it. The Lee Summit Police Department has partnered with 3 behavioral health providers to create Safe Passage, a program providing a path to recovery for people seeking treatment for substance use disorders. Joining me today are Lee Summit Police Officer Mike Eisberg, Casey Sparts, Vice President of Behavioral Health Services with Heartland Center for Behavioral Change, and Lucas Taylor, Clinical Director from Kansas City Assessment and Triage Center, operated by Rediscover. Welcome. Let's start with Officer Eisberg. Could you please describe the Safe Passage program?
Yeah, the Safe Passage program is an addiction recovery initiative started by the Lee Summit Police Department in 2018. The basis of the program is if you have somebody that is struggling with substance use or co-occurring disorders, they can reach out to the police department and just tell the police department, I need Safe Passage. And what that means is they are reaching a hand up and they are looking for help, and our officers will respond out there and provide that help. Initially, when we started the program, we didn't have immediate access to inpatient treatment for people that were suffering from substance use disorders. This was kind of a holdback, but within the last year, we've had some exciting developments. We are now able to engage. We have American Addiction Centers, which is helping with people that are insured to get them into immediate inpatient program, and we've contracted with Heartland Center for Behavioral Change, so they have a bed always available for somebody that is struggling with substance use disorders and needs immediate inpatient treatment. So right now, a person just turns around and asks for Safe Passage, we can get that treatment process started.
For the process, could you explain a bit more? Let's start with Lucas. Lucas, could you explain the role of Kansas City Assessment and Triage Center?
Yeah, thanks for having me. We are a program that is classified as a behavioral health crisis center in Kansas City. We were one of the first of its kind in the whole Midwest. And one thing that we provide to the Safe Passage program is immediate access for people who are seeking help, so that nobody who needs help or wants to enter that road to recovery has to wait until they're quote-unquote ready for that. And so we provide 24/7 access to people who are experiencing a crisis. That can include mental health symptoms. They can be experiencing substance use, including acute intoxication. So if there's somebody who's maybe withdrawing from opioids or alcohol, they can come straight to us, be overseen and observed by a nurse. We admit them for stabilization to our stabilization unit, and they can meet with a behavioral health provider, including a doctor, to get any medications for their mental health or to help with their addiction. We can speak about medication-assisted treatment, but we're able to get them started on that path once they arrive with us. People can stay up to 23 hours at the crisis center, and then we help work with them on their goals to connect them to resources upon discharge.
Oh, that's awesome. So there's actually outpatient services as well.
Yes, we have partnerships with Heartland as well as a number of other entities where people can get temporary shelter, especially now that it's getting colder outside, as well as connection to treatment resources, outpatient and residential.
That's absolutely amazing. Casey, how do you tackle the symptoms and causes of drug dependence? What could a person participating in the program expect?
Yeah, at Heartland Center for Behavioral Change, we take a few different approaches to that. We do have a withdrawal management program in case someone is going through acute or withdrawal. We're able to support them through that process to ensure that they are medically stable and ready to receive treatment services. With the Safe Passages program, we do use our community residential unit so that someone can come and live on site. And when they're there, they can be there for kind of an indefinite amount of time. We try to strive for 30 to 45 days to allow them to have time to attend treatment services, which can be the individual counseling, the group services, medication services, kind of everything that we have to offer. And then also some of that case management to ensure they have a place to go afterwards. And so we provide the immediate support, the direct care, but then we don't just leave it there. We make sure that there's a connection afterward, so that way they have a smooth transition back into the community to increase their chances of success.
So this is an inpatient program. If so, can a person leave the program at any time?
Yeah, so they are there for, however long it takes for them to have a safe place to go afterward. But they can leave at any time. So it's not locked doors, anything of that nature. It's all voluntary. The program from start to finish is all voluntary. We do encourage people when they're struggling that they work through that, and we do have people trained in de-escalation and try to support the better choices that could be made to enhance their engagement and treatment instead of leaving. So we do definitely try to keep people engaged in that program as long as they're needing it.
I was going to put in that Casey mentioned the piece about case management and having somebody work alongside the person in recovery at every stage. So once they come in, whether they're immediately intoxicated, they just maybe used a few hours ago, all the way through, the withdrawal period and then the treatment, and helping them reach their goals after treatment is part of that ongoing recovery. It's essential that they feel supported and they have wraparound care to connect them with housing, job supports. Having those services available at Heartland or through Rediscover allows that person to not feel alone throughout their recovery process.
There are programs similar to Safe Passage in the United States. Officer Eisberg, what makes this program different?
Well, this program's different in a couple of different ways. Number one, we do have that immediate inpatient access if that's needed, if that's what the person needs. The other thing is that what we've really concentrated on and what we're trying to build as time goes on is really those services after you get done with that inpatient. So that outpatient, that outreach, the peer support. What other type of services does this person need? Do they need at least some social services to step in there? Do they need the housing authority? Do they need help getting employment? So we're trying to give that person an entire 360 wrap around services. That way we can increase their ability to be successful in that recovery and have that long-term recovery for the rest of their life.
Okay. And what about this is kind of a two-parter. So are there similar programs like Safe Passage in the U.S.?
Yes, Lee County, Virginia actually is the one that started the Safe Passage program. Like I said, we have, I think, more of a 360 view than what their initial is, but they do a great job getting people into services there.
How is Safe Passage funded?
Well, it's an amazing thing that the city did a couple of years ago. They entered in with the opiate settlements. So there were several lawsuits that went against pharmaceutical companies, pharmacies that put out opiates. So we entered into the actual settlements with those, and we're going to receive approximately $450,000 over 10 years to be used for opiate treatment. So people that are struggling with substance use issues with opiates, to provide them treatment. And that's where we have earmarked. The city has been very specific. They've earmarked that money towards treatment. It's not going to be used for any other program. We want treatment for our citizens and give them the help that they need and deserve. It's an amazing thing that they entered into it, and we finally are getting that money rolling in, and that allowed us to do the contracts and begin to think about the future of how we do this 360.
You guys kind of described about the inpatient program and how the Safe Passage began. What is the process for someone seeking Safe Passage?
All they need to do, if they've reached that point where they are ready for help, they can call 911. They can call our non-emergency number. They can see an officer on the street and say, hey, I need Safe Passage. From there, that officer will turn around and ask them a few different questions. Hey, if you have drugs and paraphernalia on, just hand them over. We're going to dispose of them. You are not going to be charged for those drugs and paraphernalia. We're going to take them to property so they can be properly disposed of. That's not going to kick you out of the program. We will turn around and ask you, hey, some different questions. Are you insured? If so, we'll get a hold of American Addiction Centers. If you're not, we get a hold of Heartland Center for Behavioral Change, or we get a hold of Kansas City Assessment and Triage Center. And however way that we need to get you in, let's say if you're not able to go into inpatient at this time, well, Kansas City Assessment Triage Center is going to step in, and they're going to try to see if they can get you enrolled into outpatient.
Okay. Could you guys go into depth for the process thereafter for both Heartland and the Triage Center?
So regarding KCATC as a crisis center, especially for those that, as Officer Eisberg was saying, the individual seeking help may not be ready or may be acutely withdrawing or even intoxicated, exhibiting some symptoms that need to be monitored by a nurse. And that's where we have 23 hours with that person where we can prescribe comfort medications. We can get them connected with Suboxone induction the next morning so they can get on some medications before they make it to their next step. And so that stabilization piece to make sure that they are monitored so they're not one of the things we encounter in treatment is somebody has been waiting for a bed at a residential facility and they wait so long, and then the night before that bed comes they go on one last bender. And so I think that's one thing that people have sent individuals who are withdrawing to a crisis center so they can have that safe place to go to ensure that they're starting on the right foot once they get to residential treatment.
Yeah, and then it's a very smooth process from there. We're already in communications with Rediscover's process there, so we already have beds already established with Rediscover as well. And so we have an ongoing, we talk weekly, daily at times in regards to the referral process, and so it's a very smooth transition of someone coming from their location to ours. and then they are immediately enrolled in our services. And then that's where we kick off with everything that person needs, working on that individualized approach of what they specifically need to be successful. I got one other thing I do want to add in regards to like the funding aspect, because we did mention that this is specifically for the opioid response, but it wouldn't necessarily cover the other substances that someone might be using. However, the same process still applies because of that connection and the relationships that we have with Rediscover. We were able to work together to create that partnership where they can go through the same process, and even if it's not opioids, where this, which is what this process technically funds right now, we can still provide the exact same system and treatment services regardless of substance.
That's absolutely amazing. So it's not just opioid.
And that's actually a really great point. Safe Passage is not just opioid. So this is for anybody that struggles with substance use disorder or co-occurring disorders. And it's just been a great partnership with both Rediscover and Heartland Center for Behavioral Change to say, hey, this is what we can provide here from the city side, the city of Lee Summit. What else can we do? And they have just said, absolutely, we're just going to help people where they are at, no matter what they struggle with. That's where we're going to help them.
I wanted to highlight one other thing regarding the cost, and that is that we're fortunate to have this opioid settlement money funding the entire program. Officer Iceberg mentioned that a person maybe with private insurance may connect with American Addiction Centers and go elsewhere for residential treatment, and that would be relying upon that individual's insurance coverage, using the resources that they already have available to them. And if a person does not have the ability to pay, that's really where this program shines, because nobody's going to fall through the cracks due to inability to pay. So there's no cost to receive stabilization services at the crisis center, and no money exchanges hands once they are continued on to their treatment. So that's a piece that the individual seeking help doesn't have to worry about how they're going to pay for this treatment.
So have all Lee Summit officers been trained to respond to persons wanting treatment for a substance use disorder?
Yes, all officers have been trained. We've been training them since 2018, but they've even received additional training with this last new iteration, this kind of re-release of Safe Passage. So we wanted to make sure they completely understand the process going forward. We make it very easy for the officers to help people out and get them to the right place where they need to go.
So is this a voluntary program?
Yes, it's 100% voluntary. So we're not going to force people through the program. We can't have, family members who want to try to force it. That's not the point. A person has to want to seek recovery. And if they want to seek recovery, we're going to help them however we can.
And you mentioned this as well earlier. Can a person with warrants for their arrest participate in the Safe Passage program?
They can. The thing is that a warrant is an order from a judge in order for us to arrest. But our judges and our prosecutors have said, depending on what the warrant is for, they will take a look at it. We'll bring you into our detention center. We'll let the judges and the prosecutor know that you are requesting Safe Passage, and they will make a decision from there. So I think with most of the time with the prosecutors and the judges, they want you to get treatment, and they'll try to help you find a way to get that treatment.
So say if someone comes and wants help and they're seeking treatment, but they have illegal drugs, what do you guys do, that particular situation?
So we collect the drugs, we'll collect the paraphernalia. Basically, we take it and we put it into property for proper destruction. Like I said, that person will not be charged with any type of crime. You reached out to us for help. We're not going to punish you for reaching out to us for help. If you've reached out to us, we're going to help you.
That's great to hear.
And the same at the crisis center. If we find that there's any kind of substance or paraphernalia, we dispose of it safely and make sure that, again, they have that head start into recovery without any temptation available to them.
Awesome. Are there any eligibility requirements such as age, residency, or insurance?
So they do have to be 18 or older at the current time. It's one of the things that we're looking at in the future is to be able to provide an option for juveniles, but they have to be 18 or older now. There is no real, if somebody comes to us and they want help, we're not going to ask them where they're from. We're not going to put a residency requirement on there. You're asking us for help. As far as insurance, again, we have a method for insurance. We have a method for no insurance. We want to make this as easy for people as possible. I think one of the, like you said, the key factors of this is, and you're not seeing this across the country, is that we don't have immediate inpatient for people that don't have insurance across this country. This program is now providing that, and that's one of the key features, is people that don't have insurance, we're giving you an immediate access point that you don't have to pay for. And I do want to say that the city of Lee Summit is just, both the mayor and the city council have just done an amazing job looking at what we proposed with this program, and they were 100% on board. I mean, they want to see this program shine. They want to help out citizens of Lee Summit. It's just amazing to see that.
Yeah, and I think it's worth noting that not only is this program covered, but so is the treatment services while they're at both Rediscover as well as Heartland, but also the outpatient services. If they don't have the ability to pay, then it is also covered, and they are able to have that ongoing treatment for the duration of their care.
Yeah, the program doesn't end there. So once they complete the inpatient stuff and the road to recovery, you've mentioned this before. What does that look like for someone they've just left either treatment center and they've decided to go on with life again? What's the next steps? How are they going to get more help?
Yeah, whether they leave Rediscover or Heartland throughout this process, hopefully that system is still going to be the same, where they're linked up with a provider, and that could be Rediscover, as they do have some treatments here in the Lee Summit area. And it would turn to the outpatient side of care. And they would be able to come as often as they needed, so they can come at an intensive level, multiple days a week. They can receive the individual counseling services. Basically, all treatment services would then be kind of offered within that. So that's individual counseling, group counseling, peer services, medications, and the medications are covered as well. So the list kind of goes on of everything that we possibly have at our disposal is offered to all of our clients.
Another note on that, Casey, I think it's an important distinction to make between outpatient and residential services, and I do want to highlight that this program exists to be as low barrier for access as possible. So it used to be, many years ago, that there was a very clear stage model where everybody needed residential and then stepped down into outpatient. And now if a person says, I can't be away from my life for 21 days or however long a residential stay might be, that person who has natural supports built in their lives may really thrive in recovery on an outpatient basis. So we may not need to do residential first. The key is assessing thoroughly that person's level of need and stage matching the interventions to meet that person's need. And whether a person spends just a short few hours at the crisis center and then goes right into outpatient services, or whether they enter a more intensive residential program, assigning staff to follow them and to ensure that they can navigate each transition effectively so that they feel supported and that recovery continues with support is what we all strive for.
What happens if an individual is not successful in completing the program?
Well, we do like to reach out again, and we want to reach out multiple times to say, hey, what can we do to help you out? What can we do to get you back in the program? We don't put up a barrier. A person doesn't complete the program. If they want to go through Safe Passage again, okay, go through the Safe Passage again. If they don't complete it again, it takes an average of 7 times for a person to actually get to that point where they're on the road for long-term recovery. So if it takes 7 times, it takes 10 times, it takes 20 times, that's fine. We'll get you in 20 times for Safe Passage. Whatever you need.
That's good to hear.
Yeah, and that's going to be true for the outpatient services as well. The door is always open.
And we have to also talk about what success looks like and really understand what is a success in this program really looking like. Is it serving a high number of individuals, or is it the person's time of abstinence away from drugs? But ultimately, every person who gets the help, who connects with services, that is a kind of success. And we work together to continue to engage them. Maybe that engagement ebbs and flows. They drop off for a little bit. But as Officer Iceberg shared, it's a road to recovery. Certainly, the road to recovery is bumpy, and people struggle at different times. And having that support built in to come alongside them and say, I still believe in you. And they can enter the treatment continuum at any point, even after they've fallen off for days or weeks. We stay patient. We stay engaged.
That's amazing to hear, the engagement, and to tell them that we believe in not just Lee Summit residents, anyone who's coming here, anyone who needs help. Awesome to hear that. Is there anything else any of you could inform listeners about Safe Passage and how it connects individuals to treatment and recovery resources?
No, I don't really have a lot to add on that. I think in this instance, the police department is truly here to help protect and serve the individuals and help them through their recovery process. And so I think that's something that's worth mentioning and noting, because that's not true everywhere. And so having an entire police department trained on that process to support the individuals and to help them get through their crisis is incredible, and something that Lee Summit should be proud that they're offering.
I'm glad you said that, Casey, because I was going to give kudos to the Lee Summit Police Department and Officer Iceberg specifically because that component of police intervention is so intertwined with drug use for decades, and how how much stigma is attached to that. And when a person is allowed to approach a police officer or a public servant here in Lee Summit and say, I need help, there should not ever be a fear of recrimination or they're going to get in trouble. It's, we truly believe in you as a citizen of this community, that you can improve, you are capable of recovery, and we want to support you, not punish you. And I think that's such an important destigmatizing effect for mental health and substance use, that help is there and they can go to people who aren't scary and ask for help, and that help is readily available.
All right. Well, thank you, each of you, Officer Eisberg, Casey, Lucas, for joining today's podcast. To find out more about Safe Passage program, visit cityofls.net/safepassage. Thank you, everyone.
Thank you.
Thank you.